All right, fantastic. Scalpel, please. Thank you. Hey, you want to see something interesting, Jim? If you touch this part of his brain right here, his leg will actually twitch a little bit. See that? Can actually make it go to the beat of the song I was just singing. Ready? Is that funny? La 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 la. And watch, if you touch the brain right here, you can make his eyes twitch a little bit. Look at, isn't that cool? I wonder what happens if I touch this spot. Oops. Hey folks, welcome to the reboot of Better Off Med, a no bullshit guide to medicine and a look into the lives of the people that are here to keep you healthy. But before I get started, my lawyers made me do a legal disclaimer. What I am about to talk about is by no means to be confused with medical advice. This is for educational and entertainment purposes only. If you think you are sick or injured, please do me a favor and see a doctor. This week's topic, near and dear to my heart, the all too familiar sinus infection. I think it's weird how often I see sinus infections because in school, you got like 10 minutes of it. Mr. Johnson, what is it that I'm seeing you for today?
I think I have a sinus infection.
Mr. Smith, what is it that's bothering you today?
Hi, Doc. I think I have a sinus infection.
Mr. Sullivan, how are you feeling today?
Sinus infection.
Mr. Jones, how can I help you today?
Oh, it's a sinus infection.
I know, it's a sinus infection.
I have a sinus infection.
Don't say it. Don't you say it. Don't.
Sinus infection.
Sinuses. In PA school, we got like 10 seconds of sinus introduction and how to treat them. I didn't know that 80% of my patients would come in with sinus infections. We can chalk most sinus infections into the area of, cool it off, folks, you're not dying, trust me. Of course, there's the potential of it spreading into your brain and causing a brain abscess and then it going into your bloodstream and you get septic and then you die a slow, horribly agonizing death. So I guess if your brain is infected, yeah, you might want to see a doctor. But for the most part, you don't have to worry about that. Let's talk about the all too common run-of-the-mill sinus infection. How do you know you have one? How do you treat it? What do you do for relief? I'll tell you what, instead of getting into all the physiology of what a sinus infection is or isn't, I'm gonna grab some stuff from around my office and I'll show you actually what's going on inside your face. Come on.
All right, guys, I'm gonna use this bag to represent your sinuses. Typically, they're filled with air. And then you get a little bit of mucus in there. If you get sick, that mucus, which is usually watery, will build up at first, and then what they'll do is drain down to the back of your nose. This is why we get a runny nose when we're sick, and everything's working out good. When we cry, we get lots of excess mucus because basically sinuses make mucus, mucus drains down to the back of your nose. Now what happens when the drain going down to the back of your nose gets a little plugged? Well, that mucus builds up. You get extra mucus. And now I'm going to kind of tighten this off right here. And that causes pressure and pain and all sorts of horrible stuff. This is like the first, 3 to 5 days of being sick. You get this pain. So picture this being in your face, right? And it's building up with pressure. It's unable to drain out the back. So it's just pushing on your face and pushing on all those nerves and causing lots of misery. I like to tell people to take some Sudafed. Sometimes I'll treat with prednisone. And what that really does is open up, my glove got stuck there. It opens up those drains in the back and allows our body to get rid of it. So that's how everything is supposed to work. What happens if we can't get that drain to open up? Well, if our sinuses aren't draining properly, what will happen is white blood cells will fill in the sinus area and then turn that once clear, liquidy mucus into a gross, thick, yellowy mucus. This is why a lot of people think that when they start blowing this stuff out of their face, that they have a sinus infection. This is actually just white blood cells doing their job. They're getting into those sinuses and they're basically fighting off a bacterial sinus infection. Now what happens when this stuff just festers? It doesn't make its way out of your sinus passages and it just hangs out there. 10 days, 14 days, 21 days. Heck, I've seen people with this that last 4, 6, 7 weeks. Now we can run into a little bit of trouble because that bacteria that's in there can slowly build up. It's dark, it's moist, it's a perfect breeding ground to get a bacterial overgrowth in your sinuses. All right, so now we got a bacterial sinus infection. Believe it or not, even with these, most people will do just fine taking the same old stuff, drinking plenty of fluid, taking guaifenesin, Sudafed, and sometimes a prednisone taper will help with that. Worst case scenario, this stuff just gets trapped there. Bacteria are building up. We can't get it out. People are miserable. They have a fever. They literally have a pus pocket in their face. With those folks, we have to use an antibiotic. Antibiotics are tricky in this case because it's hard to get them deep inside the facial bone structure to get in there and kill the infection. And even though we do that, even though we give you an antibiotic to kill that infection, you still have to get this stuff out. And to get it out, you need to, again, go back to the guaifenesin, go back to the Sudafed, and go back to plenty of water. So that's it. What do you think? I just wanted to play with that for a minute.
So that's all you need to know about sinus infections. You officially know more than I did when I came out of PA school. Thanks for checking out the new episode of Better Off Med. I'm going to be trying to do these a lot more often. Click subscribe below, do all that other stuff that people tell you to do. I don't know. I got nothing else for you. Until next time.